Okay, what did you just get finished doing?
I just got through making a list of my chronic health issues.
Why did you make a list of all your health issues?
So we can talk about chronic health issues and getting the COVID vaccination.
So you just recently got your COVID-19 vaccination?
Yes, 2 weeks ago.
And that was your first one?
My first dose got Pfizer.
And do you think you'll get the second one?
I'm still undecided.
Do you think it was important for you to get the first one?
Yes,
Why?
in hopes that my body will build up some sort of antibodies against COVID. So maybe if I were to get it, the symptoms wouldn't be as bad.
I know you have type 1 diabetes, but what other kinds of health issues do you have that could put you at risk for COVID or something like that?
I have CVID, common variable immune deficiency.
What is that?
That's my body doesn't make enough antibodies to fight off infections.
So things like colds, pneumonias, flu, sinus infections, bronchitis, or even COVID, that could be really harmful to somebody with an immune deficiency, couldn't it?
Yes, absolutely.
Does that mean that you get sick a lot?
It does.
And do you have trouble getting better sometimes?
Usually, yeah.
Okay. What other kinds of health issues do you have?
I have asthma. I've had asthma for about 42 years. I have dysautonomia. Diabetes has affected my autonomic nervous system. Fancy way of saying my heart races. I'm on medication for that.
So dysautonomia, that means dysfunction of the autonomic nervous system, right?
Very good.
And that's your autonomic nervous system. That's everything that controls everything your body doesn't have to think about doing. So your heart rate, your breathing, your blood pressure, digestion, all of that. And that means that sometimes you get really dizzy if you stand up too fast, or your heart races really fast.
Absolutely.
What about your heart? What kinds of issues do you have with that?
At one point, I was diagnosed with congestive heart failure. I have an enlarged heart. I have mitral valve prolapse.
Okay, so you have an enlarged heart, and that means that your heart has to work harder sometimes to beat, right?
Right.
And the mitral valve prolapse, that means that your mitral valve isn't doing what it should, and that makes your heart have to work harder sometimes too. And sometimes you can get a backflow of blood in your heart from that, right?
Right.
Okay. Any other issues with your heart?
Tachycardia? I don't think so.
So tachycardia just means
Oh,
sometimes
sorry.
you have a really fast heart
Yes,
rate,
really fast heartbeat.
but you're on medication to help
I'm on-
control that.
Right. Medication twice a day to help keep that for a normal for me, around 90 beats a minute.
Okay. And what other kinds of health issues do you have? What about your lungs?
Currently, I have chronic respiratory failure. That could be from the asthma. That could be from the diabetes. It could be from an enlarged heart. I have a pleural effusion in my right lower lobe. The right lung has 3 different lobes, but it's not big enough to have a chest tube, thank goodness. I have atelectasis.
What is that?
It's the alveoli, the small air sacs in the lungs will rupture, and those can cause scar tissue in the lungs.
And the alveoli in the lungs, those function in gas exchange, right? So that exchanges your oxygen and carbon dioxide?
Right.
Okay.
You just made me realize something. Okay.
So atelectasis, that means that you have damage to the smallest parts of your lungs.
Right.
Do you think that's why you're on oxygen?
Well, I'm sure that's contributed to it. My carbon dioxide has been high, and when you just said gas exchange and with atelectasis, you just helped me to realize, I wonder if that's why my carbon dioxide's been elevated.
It could be, yeah. But what other kinds of health issues do you have?
I have an enlarged fatty liver. I have hypothyroidism. My thyroid it's too slow. So I'm on medication for that. I've had all sorts of anemia through the years. I'm currently being treated for vitamin B12 deficiency. I take a shot every other week. I've had macrocytic anemia.
What does that mean? Macrocytic, that means too big and cells. So your red blood cells were too big and they weren't shaped correctly, right?
Yeah, my red blood cells were too big, and they were dying off quicker than they should. A red blood cell can last 60 to 90 days, and new ones are usually made.
And that was 2 years ago?
That was 2 years ago.
So they think that your body's immune system attacked your red blood cells, right?
Right. Went through all sorts of tests with, 2 or 3 different doctors. And my hematologist finally said that he didn't know for sure what was causing it, so we just blamed it on my autoimmune issues.
And what other kinds of health issues do you have?
Microalbuminuria. Don't ask me to spell it.
And that means that you spill protein in your urine sometimes, and I'm sure that puts your kidneys under some stress, huh?
Right. And that's from having type 1 diabetes. When I was diagnosed with it, I was started on a medication that can either slow down the progression or it can reverse the damage that's been done in the kidneys. And thankfully for me, it has reversed it, and my kidney function studies have stayed normal since I started that medication.
Okay. What about your digestive system? Any problems there?
Gastroparesis and irritable bowel disease. Whew.
Could those also be autoimmune?
Absolutely.
What about your back and your neck? You've got degenerative disc disease.
Mm-hmm.
So the joint spaces are wearing away and your spine is just bone on bone, and a lot of your other joints are bone on bone too, right? So all the cartilage and the fluid in your joints, that's wearing away. You've got different kinds of arthritis too.
I have psoriatic arthritis, osteoarthritis, osteoporosis, osteopenia, scoliosis.
So the osteoporosis, that's weak and brittle bones, and then osteopenia, that's where you don't make enough new bone.
Right. I'm on medication for the osteoporosis, and it's helped slow that down some. I get a bone density test every couple of years.
Okay. What other kinds of health issues do you have?
I have reflux.
Mm-hmm.
I'm on medication for that. And in case anybody hasn't noticed, all these chins, I'm also morbidly obese. My BMI is 43. It's between 43 and 44.
And how are you managing that? Through diet and exercise? Trying to?
I'm trying to get better. I've been what I call grazing since we've been home for the most part from COVID. We've been, when COVID first hit where we live at, we both tried to stay home more so than what we normally would.
Do you think something like COVID could be really dangerous for somebody like you.
Absolutely.
And you feel like it was important that you got your first COVID vaccine.
Yes.
Would you make the same choice again?
I'm still considering whether I want to get the second one or not. I'm still undecided.
Is there anything else that you want to talk about? Like, if somebody like you were to get COVID, do you think your body would be able to handle an infection like that? Because you've had pneumonia before and you've had colds before, but what's concerning about COVID?
COVID can cause multi-system organ failure. That means your heart, your lungs, liver, kidneys, all that can just check out and not be able to be brought back.
Does that worry you?
Worry, for me, I try not to worry. I try really hard not to worry. That doesn't mean that I don't worry. I don't worry so much about myself if I get it. If I get it and it kills me, I'm concerned on how that will affect you.
Yeah, you're my only parent, huh?
Right.
So, you got the first round of the COVID vaccine. What was that like for you? How did it affect you?
The first day that I got it, I really couldn't tell that I even had gotten the vaccine. The day after the vaccine, I had trouble urinating. And I paid attention to that because I had taken a fluid pill when we got back from getting our vaccines. And normally when I take a fluid pill, normally it's sit on the commode for at least 15 or 20 minutes at a time, and the urine will just, flow on out of me. But that day, and I'm urinating all day long when I take a fluid pill, but that particular day, even with my fluid pill, I went maybe 3-4 times during the day, and I found that really odd.
But it's difficult to attribute something like that specifically to the vaccine for right now until we know more about it, right?
Right.
Okay. What other kinds of side effects did you notice?
I had headaches, body aches. Oh, body aches. Hello. Yeah.
Did it feel a little bit like having the flu?
It's a little bit worse
Mm.
for a few days after that. It made my heart race more than usual. What else? I think that's it.
But you don't regret getting the first vaccine.
No.
And you're hoping that it will help you make antibodies to COVID so that if you get it, that hopefully it won't be as severe and hopefully your body will be able to fight it the way that it should.
Right.
But you said you have an immune deficiency, right?
Right.
So if you have an immune deficiency and if you're deficient in specific antibodies, is there any concern about how your body might not be able to make antibodies correctly?
There's always a chance that my body won't be able to make those antibodies. It's like flipping a coin, Maybe it will, maybe it won't.
But we're going to hope that it does.
We're going to hope that it does.
Is there anything else that you want to talk about?
I think so.
Would you like to hear from other people who've gotten their vaccines too?
Yes. For you folks out there that have chronic health issues, please, in the comments, comment on how you dealt with the side effects, what side effects that you've had. with your vaccination, or if you had side effects at all, and what were your concerns in regarding to choose to get it or choosing not to get it. You know, don't forget to like us, don't forget to share, and subscribe to our channel, the Threadgill 3.
The third one is the dog, huh?
Yes, I'm 1/3, you're the second third, Patience is the third. We make a whole.
Yeah. So I would like to hear why other people are getting vaccinated, because I got my vaccine not just for myself but for you too, because I don't want to risk infecting you with COVID or anything like it. So I'd like to know why people are getting their vaccines. Is it for themselves, or is it for people that they love, or their family, or because of their job? But yeah, I think we can end this here.
Okay, see you folks.